nearly 4 children are killed every day in South Africa. That's according to the latest statistics released by police. The lives of 352 children were cut short between October and December last year. However, 394 children survived murder attempts, and a further 2,048 were victims of physical assault. Unicef is working with the Department of Social Development and other partners to try and tackle the scourge. We speak to Christine Muhigana, Unicef South Africa representative. Christine, good afternoon to you. Thank you so much for joining us. Now, this is quite an alarming number, isn't it? But what needs to be done for there to be some kind of ongoing awareness about this large number, 4 children being killed, being murdered on a daily basis?
Yes, good afternoon. Thank you for the opportunity to join you and others, the public, the society at large, to speak up about this unacceptable level of violence against children, this unacceptable unacceptably high level of child murders in South Africa. Beyond raising awareness, we are of course fortunate that this data, this information is available, that the South African police is making this information available to us. We would actually also want it to be broken down. This is something that we're working on with partners to have a better sense of, who are these 352 children who died in the span of 3 months at the end of last year, what age group, also what gender. And clearly something needs to continue to be done. Efforts need to be continued to be strengthened in support of what the Department of Social Development is doing with other partners. We support them, and particularly on prevention. And when prevention fails, on early intervention, and in the unfortunate situation where we come when things have happened, emergency intervention. So we're working on a span of interventions with our partners to bring down this really unacceptable level of violence against children in South Africa.
I think what is the scary part really about this, Christine, is the issue that these are children that are being murdered. So they don't die in any other way but through murder. We've also said now that 394 children have survived attempted murders. As UNICEF South Africa, you've spoken about the interventions that you are taking, but these are really huge numbers. How can families try and mitigate? I mean, it is obviously something that is difficult for one to prevent their child, if somebody from being murdered, really, but there must be some kind of preventative measures that can take place here.
Absolutely. And the interventions have to be done early. It's about parenting, because unfortunately many of these children are dying at the hands of people they know, people who are supposed to be caring for them, people who are in the community, family members. So what needs to be done is look at the root causes, the causes of this violence of caretakers, of families against their own children. It's about stress. It's about intergenerational levels of trauma. Oftentimes, these parents or the people who are perpetrators of these murders have themselves been victims of violence in their own families. So we need to address these issues through a positive parenting, for example. This is something that we do with partners in support of the Department of Social Development. It's about relieving the stress that some of these families go through. It's about poverty. It's about the stress that comes with the fact that you don't have any livelihood. It's about the stress that comes with being idle in society, young people joining gangs and turning against each other violently and killing each other. So the response has to be something that happens in the community with all stakeholders, with child and youth care workers, with social workers. It has to be done in schools also. It's about, bringing awareness to families, to caretakers about the signals. How do you see that a child is in danger of violence? If you're a neighbor or if you're a family member, who do you go to alert that there is a child there in danger? What can be done about this? There's the child, so it's about preventing something happening. It's about when you see something, when you see a child that's bruised, a child that's showing signs of distress, intervening early in the family, and this goes with building trust. The social workers have to be trusted by children, by family members, so that they are alerted of a situation, so intervention can be done early on.
And of course, this also goes with what you've just mentioned, goes with the teachings to a child, teaching a child how for them to speak out if they themselves are feeling threatened in any way. And these are the conversations that need to be had in a family home, Christine.
Absolutely. In a family home, so the parents are actually the first ones to have to be aware, have to be tooled, have to be empowered to be positive parents. They ought to be able to nurture their children. But if that's not the case, unfortunately, if you have a parent that's under stress, depressed, traumatized, a child has to be able to seek help for him or herself. We work with a partner called Child Lines. It's a hotline that children can call. They have to be aware that such a service, such a relief exists. If it's a younger child, other children in the family or in the community ought to be aware that this is a service, this is a helpline that's available, so that they can seek help.
What more do you think can be done from the police's side, to try and catch these perpetrators? We have often seen how perpetrators are released too early, even those that have committed murder. They get short sentences, and it seems as though for those that are the victims and the families of the victims, it seems as though the justice system is not being harsh enough on those that have committed such murders or attempted murders on children specifically. What more should the police be doing in instances such as these?
Absolutely. The partnership between social workers, families, society, and the police needs to be stronger. Case management of such cases need to be integrated with the justice system. As you said, perpetrators are oftentimes, unfortunately, arrested only for a short period of time, either because there's the police system is overwhelmed, or because the cases are not brought to justice. So there's no formal complaint. So families, again, caretakers have to be accompanied, have to be supported, have to be empowered to go through the whole process. It's not just, about caring for the child if, you're happy enough for him or her to have survived the violence, but it's also for you to go through with the justice, to go through with seeking justice for the wrong that was done, and, bringing the evidence, and it's about social workers, parents, caretakers working with the police system, so that case management of violence against children includes also the justice, the seeking of justice.
From these stats that we received, Christine, around the number of children, 4 children being killed a day, so that means then 352 children were violently killed between October and December of 2021. Has this been an increase or a decrease in the numbers, and does it really tell us much from what we are seeing?
Actually, if you look at the same period in 2020, it's a slight decrease. But if you look actually at those who survived the attempts of murder, there is an increase. And what these figures are actually telling us is that it's too many. 3 children or almost 4 children killed every day in South Africa. It's slightly going down here, but it's higher if you look at the number of children who survived the attempt of murder. It's the figures are saying it's too much, it's too high, it's unacceptable, and we need urgently to do something to address it.
Christine Muhigana from Unicef South Africa representative. I mean, 1 child killed is 1 too many. Thank you so much for having this conversation with us, and just what can be done to, prevent children